I have continuous pain from my sciatic nerve, from my rear left hip down to my knees, foot. I have L4, L5, and L5S1 disc bulge. Any suggestions? This is the question I'm going to dive into and answer inside this segment of Ask Dr. Walter. And not only am I going to answer this question, I'm also going to go through the six key things that I would do in my office if a patient presented with this condition. Now, this is not individualized recommendations by any means. Still get checked by your doctor, physiotherapist, or chiropractor. But this is what I would do if a patient came in with this clinical condition. The first and foremost thing, after doing a consultation examination, I would take full spinal x-rays. Full spine x-rays from the front and from the side. We take a segmental view, so there'll be a front and side cervical view, front and side thoracic view, front and side lumbar view. Then I assess those and look for any spinal distortions and spinal misalignments. That's important. That's going to set the stage for my analysis. Now, even though there's a disc injury inside this condition right now, the way this person's presenting, and an MRI may actually be a definitive diagnosis for that and tell us that there's a disc injury, I want to see how the spine is related to the injury. Is there a misalignment? Is there a distortion? Is there a tilt? Is there something that's out of position with the actual balance of the spine, which is the body posture position as well? So it's very, very important. That's one of the things that I would look for right off the bat. Number two, I would check the sacroiliac joints. Why would I check the sacroiliac joints, which are also called the SI joints for short? Because the SI joints can very much be a pain generator in these situations. Now, sometimes they are the pain generator and nothing else. Sometimes they're the pain generator on top of something else like an L4, L5 disc or an L5S1 disc bulge. So if I take my thumb and I press in the L5 area and L4 area and there's local tenderness, that will point more towards the pain generation coming from the L4, L5 area or L5S1 area. If I press into and palpate into the SI joints right and left, and those are tender, that tells me that the SI joints are pain generators as well. Those are just some of the testing that we do to differentiate the two. And of course, the treatment would be indicated for each one a little bit different on how we correct and adjust the SI joint versus L4 and L5. Number three, I would take what's called the modified Ferguson X-ray. It's a specialized view. It's that looks for the leveling of the sacral base and also for any anatomical leg length differences. What that means is, so think about this, the spine sits on the sacrum and the sacrum should be level. If the sacrum's tipping down or tilting or unlevel or uneven, then that can cause a distortion at L4, L5, L5S1, and that can cause the spine to tilt to one side or even buckle and curve to one side. And that can be a major problem for the L4, L5 area and L5S1 area, causing damage over time and leading to disc injuries and also pain. And if there's an anatomical short leg, that can be a contributing factor to the sacrum being unlevel. Sometimes the sacrum can be morphologically unlevel, just the way it's been designed. Sometimes there's an anatomical short leg. Either way, that X-ray called the modified Ferguson gives me an idea of how much of a difference the sacrum is from one side to the other in terms of its off levelness. And then we provide a heel lift into the shoe, not an orthotic, an actual wedge or heel lift into the shoe to elevate the leg and try to level off the sacral base. And that makes a massive difference to many of the patients that I've given that to. Number four, sometimes I refer my patients to other practitioners like physiotherapists or chiropractors that do laser therapy. Laser therapy is a modality that uses light or laser, right, to actually help expedite the healing process and help reduce the inflammation. That's something you can look into as well. Number five, then the one thing I would consider is looking into a corrective care chiropractor. So I'm a corrective care chiropractor, and why would I say that is because we want to focus on correcting the structure before the function. Oftentimes, one of the biggest mistakes that many people do, and it's no fault of their own, is that they're led to correcting the function first, which means the strengthening, the mobility, the balance, flexibility, the movements, right? Before the structure was ever analyzed. So you have to analyze the structure of the spine, analyze the levelness of the pelvis and the sacrum, any unleveling of the leg lengths and the sacral base, all these structural distortions, but even posture, your body position in space, all these structural distortions that can be basically the conditions that lead to injuries at L4, L5, and L5S1 disc area, and also the associated nerves, which can trigger pain down into the leg. So look for a corrective care chiropractor. Now, the last one I want to mention is exercises. Everyone was asking me what exercises. So this is number 6. 3 top exercise that I give to most of my patients in these conditions when they're ready for them is, one is for mobility, cat, camel exercise, very good exercise to do. Number 2 is for stabilization, bird dog. Bird dog, you're on all fours, quadruped, and then you're cross crawling arm and leg. right? So bird dog, sometimes if bird dog's too hard, we start off with prone cross crawl. So that's number 2. And then number 3, a modified side plank. Full side plank might be a little bit difficult at the beginning, but a modified side plank, if tolerable, is gonna be really good to actually help get those stabilizers, the multifidus muscle and the lower back stabilized and strengthened, okay? So those are the 3 top exercises that I would do. Now, if you wanna watch more of Ask Dr. Walter, go look back at the past 30 episodes that I have right here in this playlist right here, and I'll see you on the next video.